Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane. Dr. Pane is here to answer your cosmetic surgery questions live on the air. And this question, Dr. Pane, comes from Facebook, and a person's asking, what would be better to have, a circumferential thigh liposuction or inner-outer thigh liposuction? Dr. Pane, what would you suggest in this situation?
Well, it's a good question. Now, from this picture, the person is relatively slim, and there is some inner thigh fullness, and they're concerned about they want to get a space, like a thigh gap, so to speak. Now, when you talk about circumferential liposuction of the thighs, we're talking about going all the way around, doing different zones of the thighs. Thigh liposuction is another tricky area. In our practice, because we've done a lot of liposuction, we are familiar with kind of all the different, ins and outs of it. We will do liposuction in some areas that most people may not want to do. There are a few techniques you have to be careful with so that you get good results. So sometimes if you go to see someone, they may tell you, you can't do this, you can't do that. That may be true depending on what it is. But you kind of want to check around to see, if the practice is doing all of those things, or are they just telling you that because they don't do it? Because sometimes they may be right, but other times they may just not want to do it. Now, people that get circumferential thigh liposuction usually are pretty big, heavy people that want to just debulk the overall thighs, and they're not as concerned with the skin appearance. That's important because a lot of times the skin is wavy to begin with, and by doing the all-around thigh liposuction, you're really just debulking the leg. We always try to leave the skin as good as we found it, maybe even a little better if there are areas that can be smoothed out. But it's important to realize that if you're looking to do the debulking, your primary goal has to be reducing the volume. And if the skin is not perfect, that has to be okay, or you shouldn't do the procedure. Because if you do this, you're doing thigh liposuction in some areas that skin is thin, and it will show some of that waviness more than some other areas of the body. That being said, we really have a good record of not having real serious skin problems after this procedure. For the inner-outer thigh lipo, that is for somebody that is more on the slender side. It can be done on some of the larger folks if they just want to do those areas. But a smaller person is usually not going to get all the way around circumferential liposuction because there's just too little margin for an issue. There's just not enough fat in most of those zones. But there are areas of the thighs that can be done at least a small amount, especially if the person is doing something else. So let's say a smaller person is doing a fat transfer and we need to find fat from wherever we can get it. Sometimes we'll do some areas of the thighs because you can get something there, but you just have to be careful with the skin. And with the inner and outer, I'm going to just draw something right here. When you talk about inner and outer thigh lipo, you kind of have to watch it because you want to make sure that you're giving a proper curve here. So, when somebody has, say if there's bulging going on, kind of the outer side here, you want to get the waist to hip ratio kind of right. And for the inner thigh, this is where the inner thigh lipo is taking place in here. This business about getting a space in between, you have to keep in mind that you're not going to over suction that area just for the purpose of getting a space. You may or may not get one depending on how your skin goes. But if someone tells you, oh, I'll take out all the fat to give you a space, that's potentially tricky because you could get skin damage if too much fat is taken out. Now for the outer curve, sometimes people have a big bulge kind of like this going down like that, and it's a little less aesthetically pleasing, and those will take down. But a lot of times if people have a good curve out here and you have a good ratio, you want to think about leaving that. If it really, really bothers someone, you can do it. But outer thigh lipo, you run the risk if you alter that feminine silhouette too much. It's not always ideal. So it depends on how much of a bulge is going on. And again, there are still some special techniques to make sure you get a good result whenever you're dealing with the thighs. It is trickier than when you're doing the back or the bra rolls or the flanks, areas where you have very thick skin that does not show as easily contour irregularities. With the thighs, it's a different story. You got to use smaller cannulas and a couple of different techniques. So hopefully that covers it. Circumferential thigh lipo usually for larger folks, not as much for smaller folks. Inner and outer, pros and cons, and then the issues with the thigh gap, and keep in mind the thinness of the skin in this area of the anatomy. So hope that helps.
Well, thank you, Dr. Pane, and we appreciate your time. And if you have a question for the doctor, please visit our website, Instagram, Facebook, or by using the link below. Dr. Pane, we appreciate your time, and we'll see you on the next one.
Great.